Hello, everyone. So, this month we've been talking about healthcare, and I found that the biggest challenge with healthcare in the US today is cost and access. So, some challenges due to cost of care, but others, even with health insurance, have the promise of care, but they don't actually have access to care. And today I'm going to be sharing the ways that direct primary care model addresses both these challenges. So you're listening to Connecting the Dots with Dr. Ashaye. I'm your host, Lola Ashaye. I'm a family medicine and lifestyle medicine physician, and I'm the owner of In Touch Primary Care in Sugarland. We're an innovative medical clinic where we offer an alternative way to receive healthcare that is stress-free and focused on the patient. Okay, so let's talk about cost of care. So healthcare in the US is expensive, and there are many reasons for this that we don't have time to go over. But clearly, the responsibility has been placed on the individual to pay for this. So for those that are employed, they have access to insurance. They may have access to insurance, but employers may help. So the employers may help carry some of that burden, but really it's built into your compensation. So in the end, the individual is really paying for healthcare because even if your employer is paying for part of it, that's built into what they were going to pay you anyway, right? So many are unhappy about how much they pay monthly, but at the same time, they're concerned about needing to pay out of pocket for an unexpected illness. So as a result, a lot of people just, pay for it, which makes sense. You want to make sure you're prepared, right? But these days, majority of the plans are high deductible plans. And you can learn more about how these work from our last episode. I had Paul Mays, an insurance agent, who explained a little bit more about high deductibles. So you can listen to our last episode. But essentially, you have to pay up to a certain amount before your insurance kicks in. And so high deductible can be anything as high as $2,000 to $10,000 or more per year that you have to pay first on majority of your care before your insurance actually kicks in. So many people, especially those with chronic conditions, don't actually especially those who don't actually end up meeting their deductible. So they're essentially just paying out of pocket. So you could have the person that is healthy overall. Maybe they don't have medical problems. They only go for their physical. That usually is covered by the insurance. But then you may have somebody that has diabetes or high blood pressure, or high cholesterol, or all three, or other chronic conditions that have to see a doctor regularly. And every time they go and see the doctor, it's not considered preventative. They have to pay out of pocket. The problem with this is a lot of people have no idea how much things are going to cost because in the traditional health system, you're treated first and then you're billed. So people get a lot of surprise bills. And sometimes these bills come weeks or months or even years after a service has been completed. So the problem with this is it programs people not to go to the doctor. They start to avoid going because they don't want to be surprised. Nobody wants a surprise bill, right? One you can't plan for. So the way direct primary care addresses this is by having a flat membership fee. So this flat fee is transparent. Majority of direct primary care practices will have this fee on their website. So the person knows exactly how much they're going to pay for that year. And they have that flat fee. They have access to their own doctor as often as they need it. So usually when you come in to a doctor's office in the traditional care system, you have to pay copay or you have to pay your deductible first before you get seen. Well, in direct primary care, there's no copay, there's no deductible, there's no coinsurance. You walk in, you've paid your flat annual fee, and that covers all your visits, as many visits as you need, as often as you need them throughout the year. So this way, people can actually plan for their medical expenses instead of having to guess. And the beauty about direct primary care is you can still combine it with other health plans. You can combine it with a high deductible. You can combine it with the health sharing plan. You can combine it with a supplemental health plan. You can combine it with so many other things so that you're still covered for expensive health needs. like if you were hospitalized or if you needed surgery or that sort of thing. So at that point, it makes sense, right? If you need those types of expenses, the premium that you're paying can cover your insurance will kick in because you probably will meet your deductible at that point, versus somebody that doesn't really have a big medical expense and you're just paying all the time, but you don't really have access to the doctor, but you're paying because you think you want to meet your deductible, but the deductible doesn't get met. Well, you just paid out of pocket and you didn't necessarily get the care that you wanted. So that's really what happens in those scenarios, and that's what happens to a lot of people. So the flat fee is helpful because it's transparent. You know what you're getting into. And again, it's often lower than what you will pay if you paid out of pocket, because with direct primary care, a lot of practices will negotiate for lower prices because we have that option. Since we're not contracted, we don't work for insurance companies, so we can negotiate more freely. So this model can be very helpful for people that have chronic health conditions, especially those that need periodic care or people that take medications and need to see their doctors regularly. So having something like this where it's a flat membership, where you know how much you're going to pay and you're not delaying your care because of this, it makes a difference. So that's the first thing. So let's now talk about access, which is another huge problem for many. And I've gotten interested in learning about these things mainly because I've seen how, when you seeing a patient, patient is more than just the condition, it's the person. So if you're only thinking about the condition, a lot of times you cannot effectively treat that person, because if you're prescribing a medication that they cannot afford, they're not going to get it. If you are asking them to go somewhere that they cannot get into, they're not going to go. So it's, we want being practical, and if we're really truly trying to help the patient, we need to talk about these things. We need to talk about the cost of care. We need to talk about access to care. Access is a huge problem, and that's because people with insurance, even as obviously as people without insurance, may not be able to get in to see their own doctor when they need it. So I know some of you may have experienced calling for an appointment. Maybe you have a cold or urinary tract infection or something acute, and then you're told that the next available appointment is in 2 to 3 weeks. And so now we have urgent care, we have telehealth, we have many other, 1 minute or all kinds of places that people can go now. Those, have their advantages in terms of, if you have a doctor you can follow up with afterwards in a reasonable time. But the problem is it does come with risks. And this is especially true for people taking multiple medications or people that don't even see a doctor regularly. And because the truth of the matter is, it takes time to get to know the health of a person. So even when you have a doctor, sometimes as a patient, when we ask you questions, sometimes you forget. You forget your health history, or you may not even think something that happened is relevant to tell us about. And when you now see somebody that has no idea who you are, and they are examining you, and they're really only focused on the concern that you came for that day, it's very easy to miss something else. It's very easy to cause complications. And a lot of times people do not connect the dots. They do not realize that what they did here actually was what caused something else they had. So for example, maybe you have menstrual cramps and they're really bad. And you decide, you know what, I can't take it anymore. I'm going to the urgent care or the emergency room or something like that. And maybe you're taking a baby aspirin for something else, right? Maybe you have a clotting disorder or something like that, but it's over the counter, so you're not even thinking that it's a big deal, or anything, right? And then you go there, and then they tell you, oh, you need to take, Motrin, or they prescribe you naproxen or something like that. And then guess what? Now you have abdominal symptoms now, because both the aspirin and the Motrin or the Aleve or whatever else you're taking can thin your blood and cause irritation of your stomach that can, if even lead to a bleed, right? So that is something that seems so simple that can cause problems because the person you're seeing does not know your history. If you had a primary care doctor, they should have, all your medications and including your over-the-counter medications. And over time, they find out. I've had patients who you ask them to bring in all their medications, and by the third visit, I'm learning about a new medication that they're taking that they forgot to tell me about. So when a person sees you once, it's very easy to miss things. That's number one. And then if you're taking a lot of medications, it's very easy for interactions to occur because sometimes you don't understand what you're taking, if one can interact with the other. So there's just a lot that can happen, especially in an environment that is rushed. And so having your own personal doctor that knows you makes a big difference. This also plays out in somebody that maybe they don't go to the doctor a lot. So they feel like, oh, everything is fine. I don't go to the doctor. Maybe they have something going on with their liver, their kidneys, which maybe they don't have any symptoms because they haven't seen a doctor, and they don't know because they haven't seen a doctor. Well, they go in for pain. Maybe they're given pain medication. The next thing you know, they have a kidney or liver condition and they end up in the hospital. So I've seen these things, and that's why I'm mentioning those examples. So in general, access to care to your own doctor makes a difference, and that's one of the huge benefits of direct primary care. So the way direct primary care addresses this is easy access, same next day visits, someone that actually knows your history, someone that you can actually reach via text or email, someone you can actually call and reach directly, so that when there's an issue, it can actually be addressed. So that benefit alone makes all the difference. The fact that in the direct primary care model, you have access to your own personal doctor. In addition, the direct primary care addresses just overall health, and because again, it's cost savings, and by having access, you can save costs because you can prevent many complications. You're not delaying your care anymore because you're afraid about a surprise bill, and you can keep up with your doctor. You can let them know when something is happening, even if you're not sure it's relevant or serious. You can let them know early so that if it's something that needs to be prevented, they can get on it sooner rather than later. So you are less likely to need to go to urgent care emergency room, so you save money there. And I've seen that very often in my practice where people are saving a lot because they are able to reach me. So they're not having to, spend a lot of money outside with someone that doesn't really know them as well. So health direct primary care is also cost savings for employers. And as a business owner, people can pair direct primary care with another plan that covers, the more expensive healthcare. And overall, it comes out cheaper. Or even just by offering direct primary care as a health benefit to employees, it can help a lot of business owners and employers retain, attract talent, and that does make a difference. So all having access to direct primary care in all these different ways makes a difference. So in short, there are many benefits to direct primary care. It can be paired with insurance, it can be paired with health sharing plans, it can be paired with supplemental insurance, so that everyday people can have access to premium, high quality healthcare. You can have your own personal doctor without breaking the bank, and you are covered in case of an emergency. So if you want to learn more, you're in the Houston area, the Sugar Land area, we are going to be here tomorrow celebrating our 3rd year anniversary. We're going to be having a ribbon cutting, open house, raffle, gifts. It's going to be fun, food, music, all of that. So if you're in the area, Missouri City, Pearland, Sugar Land, all that area, come join us. And the link to register is in the chat. All right, so I look forward to seeing you, and I hope I have helped you understand a little bit more about direct primary care.